Hi, my name is General Gu, and my campaign is about proactive health communication on smoking. The campaign aims to prevent commercial tobacco use among an at-risk population through outlining the damage of smoking and providing preventative smoking tactics. The health campaign hopes to reduce the number of smokers within the targeted subpopulation. The campaign utilizes multi-medium approaches in order to help highlight important health issues and attract at-risk population to engage in campaign objectives. My population is adult country in Oklahoma because it has the highest percentage of smokers among other Oklahoma countries. My subpopulation are Native American because they use tobacco at a higher rate than the overall state of Oklahoma. Smoking has become a health crisis as it is the leading cause of preventable deaths. Smoking causes many heart issues and diseases and cancers. For instance, smoking is the cause of 90% of lung cancer deaths. Smoking also damages one's blood vessels, bladder, kidney, liver, lungs, colon, pancreas, and stomach. Smoking also affects the sexual reproductive system. For example, smoking negatively affects women's cervix and the sperm count among men. As for oral death, cigarette smoker lead to tooth decay and damage to the gums. Not to mention, the danger of smoking not only affects smokers but non-smokers alike through second-hand smoker. For instance, smoking causes health problems in infants and children and infant deaths. Due to the health crisis and health issue of smoking, educational health campaign will influence smoking behaviors by changing awareness, knowledge, and attitude of smokers. Education also leads to the reduction of smokers. Educational campaign also help close the gap of some common health disparities by providing equal access to health and wellness resources. In addition, the campaign can influence important policy decisions and reduce health care spending on preventable diseases. The health theory used to approach smoking is theory of planned behavior. Theory of planned behavior links beliefs to behavior. In this theory, interventions are created for health enhancing individual behavior, such as smoking cessation and medication adherence. Behavior intention are determined by a combination of three factors: attitude, subjective norms, and perceived behavior control. If one has a positive attitude, believe that subjective norms are in favor of those new behaviors, and believe that they are capable of controlling those behaviors, then one will more likely perform the intended healthy behavior. In short, those factors help individuals build strong intention that will essentially change their behavior for the better. The campaign will use the following multi-medium approaches: graphs, animation, audio, video, and text. My flyer will relay information through text. The campaign flyers will speak about the dangers of tobacco use, how it affects, and how they can overcome tobacco use. Utilizing text allows the campaign to provide basic information. Text will help create awareness to the public. Here is an example of flyer that would be used for a campaign. I would incorporate an information video about tobacco use and preventative measure among Native Americans. The video will examine the cause, effects, possible solution of tobacco use among Native Americans. The audio is from Native Americans seeking to reduce commercial tobacco use within their community and culture. Audio from Native Americans provide authenticity and reliability for our target audience. The campaign will use educational video because it allows campaign to relay a lot of information within a very short time frame. Here is an example of a video that will be used for a campaign.
I think it's important to learn about the differences between commercial tobacco and our traditional tobacco for a number of reasons. One of the reasons is that we have one of the highest rates of commercial tobacco use as Native people.
So the American Indian Cancer Foundation really supports the use of traditional tobacco because we do believe it acts as a protective factor against harmful behaviors. And we know that as American Indian people, throughout history, we've had the breaking up of culture and family that have sometimes caused us generational loss of a sense of belonging and a sense of identity. And that often lends to issues of substance abuse.
You know, we have certain scars. We have to figure out a way how to prevent our transferring that historical trauma that we deal with to our babies and to our children. They will have their own issues to deal with, but they shouldn't have to deal with all that weight of history.
So one of the ways that we can educate people is to take them out harvesting. And one of the ways to do that is to involve kids first and the parents follow along. And it's kind of that way. I believe that if we educate our youth and we bring them out, they're going to tell us at those giveaways or ceremonies, they're going to say, hey, this is not traditional tobacco. You know, we're supposed to be offering traditional tobacco. And I've seen young people say that.
And so we believe that really embedding that knowledge is empowering to people to feel more of a sense of identity of this is who I am, this is why I use tobacco in a good way.
We believe that if people understand their teachings and begin to use these medicines in this way, that will stop the use of commercial tobacco.
The animated picture and graph I chose is a person breaking a cigarette with a catchphrase of break the habit. Having a picture symbolic of the campaign slots and purpose will help to prolong memory and reinforce the campaign's ideas. Overall, the animations are used to gather attention to expose the dangers of smoking. Here is an example of graphic that will be used for a campaign. In conclusion, the campaign discussed the negative health effects of smoking cigarettes and how a population can quit smoking through the help of education and multimedia approaches. Here comes my references, and thank you for listening.